Thyroid cancer is a rare type of cancer that affects the thyroid gland, which is a small gland at the base of the neck. The most common symptom of thyroid cancer is a painless lump or swelling that develops in your neck. The thyroid gland sits in the front of the neck, just below the voice box, called the larynx. It is made up of two main lobes, right and left, joined across the middle by a thinner strip called the isthmus. There is also a much smaller pyramidal lobe in some people. The gland is butterfly or bow tie in shape, and it produces thyroid hormones called thyroxine, T4. These hormones help control the body's metabolism. The thyroid gland also produces calcitonin. This helps control the amount of calcium and phosphate salts in the body. Compared to breast, lung, prostate and bowel cancers, thyroid cancer is much less common, with approximately 3,500 new cases diagnosed in the UK each year. There are 5 main types of thyroid cancer. Papillary is the most common type and often presents in young women, although it can be found in older people, children and men. If this type of cancer spreads, it usually goes to the lymph glands. Follicular is the second most common type and tends to occur in a slightly older group. It's much less likely to spread to the lymph glands, but may spread to other parts of the body through the bloodstream. Medullary is a much rarer type. In a quarter of patients, this cancer is caused by a faulty gene called RET proto-oncogene. Anaplastic is another rare type of thyroid cancer and tends to present at an older age. It also tends to grow more quickly than the other types and can be difficult to treat. Non-Hodgkin's lymphoma is a rare thyroid tumour. It is treated like lymphomas that can arise anywhere in the body, unlike the other types of thyroid cancer. For the most common types of thyroid cancer, such as papillary, follicular and medullary, surgery is likely to be the first course of treatment. It is unlikely to be recommended for thyroid lymphoma patients and is only occasionally suitable for patients with anaplastic thyroid cancer. If the cancer has been diagnosed before surgery, it is usual for the whole thyroid gland to be removed during the operation. If there has been difficulty diagnosing the reason for a thyroid lump, or if the cancer was not suspected before surgery, then removal of only one lobe of the thyroid may be done. If only one lobe has been removed and then the cancer is discovered in it, it is usual to consider whether the other thyroid lobe needs to be removed at a second operation. In some cases, young patients with small follicular or papillary tumours, it might be suggested not to remove the remaining lobe. Sometimes the lymph glands or nodes are also removed. The number of glands removed will depend on the size and type of the cancer, what the surgeon can see and feel at the time of the operation, and the results of any scans performed before the operation. Many patients are able to go home 1 to 3 days after their operation. Some patients may feel hoarse because of bruising to the vocal cords. You may also have low calcium levels and will need to take calcium tablets. When the thyroid gland is removed, thyroid hormone medication is needed to replace the thyroid hormones that the body can no longer make. Thyroxine tablets need to be taken once a day and are usually best taken first thing in the morning. It might also take a little while to get the correct dose for each patient, but once the dose is sorted, you should feel your normal self as the tablets are replacing the hormones that your thyroid gland would have produced. The dose will be monitored by finding out how you feel and by checking blood tests. If you're going to need radioactive iodine treatment, you may be put on triiodothyronine tablets to start with. This is given as a tablet 3 times a day. Radioiodine is a term used to describe a radioactive form of iodine. This is used to reduce the function of thyroid cells and reduces their ability to grow. It's a common form of treatment for thyroid disorders and has been used for over 50 years. It's administered via a small capsule that has to be swallowed. This is meant to destroy any thyroid cells that may have been left after your surgery. Before this treatment, you'll need to be on a low iodine diet so that the treatment can be as effective as possible. You will also need to be producing a high level of thyroid stimulating hormone called TSH. There are two ways to achieve this. First is to stop thyroid medication, but this can leave patients feeling lethargic and generally unwell. Or the second option is to have the hormone by injection called recombinant TSH. The injection is given 1 and 2 days before treatment, and side effects are generally uncommon and mild. When you arrive at the hospital, you will be booked onto a ward where they will take your details along with your temperature and blood pressure. You will be seen by the ward doctor and a nurse, and you may have a blood sample taken if it's required. Your physicist will then talk to you about your treatment. When you start your treatment, you will have high radiation levels, so you will be asked about contact with other people, so that restrictions can be made to your home life. You'll be taken to the radioiodine treatment room, which is referred to as a cubicle. You'll be asked to place your bag on the table outside of the cubicle and also to remove your shoes.
And if you just slip your shoes off as well.
You should only bring enough items for a 2 to 5 day stay, so a towel, clean clothes and your usual medication. One change of clothes will be left outside the cubicle for the day of discharge. We'd also recommend travel-sized toiletries to minimise waste. The cubicle is a bright and comfortable room with an ensuite toilet and shower room. Every effort has been made to make your stay as comfortable as possible. So you'll find that the bedding is bright, there's a window and also an air conditioning unit for use on hot days. The cubicle has everything you could need, from a CD player, radio, alarm clock, mirror and TV to a DVD player and DVDs. There's even a fridge for your drinks or snacks. There is also a tablet that is connected to the hospital Wi-Fi for you to use. You shouldn't bring anything electrical, such as chargers, hair straighteners or electric razors. There is a hairdryer available for you to use. You also shouldn't bring library books or handcrafts and leave any jewellery and watches at home. You can bring magazines as long as you are happy to leave them. There is a telephone available for you to use, but you can also bring your mobile phone, which will be safely stored inside a bag that we will supply. If you feel ill and require assistance, there are 2 buttons that you can push to notify a nurse. One is a buzzer next to the bed, and the other is a link to the nurses where you can talk directly to each other. Once you have settled into the cubicle, the physicist will administer the radioiodine capsule. The physicist will be wearing protective clothes and will talk to you through the entire process.
And date of birth, please.
Your personal details will be confirmed before treatment begins.
It's going to be in the lead pot. Okay. All I'm going to do is unscrew the top. I'm going to catch the tablet for you in a plastic tube.
You will be asked to take a tube in your own hands and to swallow the capsule.
Tip the tube up slightly so the tablet will slide down the tube. So you're in control of the speed you're swallowing at.
The capsule is relatively small and you should swallow it, not bite or chew it. You'll be given a glass of water to help you swallow the capsule. After you have swallowed the capsule, you will not be allowed to leave the room. A barrier will be pushed against the door to protect staff from any radiation. It also serves as a physical reminder that you cannot leave the cubicle, whilst also giving you the freedom to keep your door open if you wish. It also allows catering staff to deliver your meals. After an hour, a measurement needs to be taken of your radiation levels. To do this, you'll need to lie on the bed for 5 minutes whilst the physicist takes the measurements. These measurements will be taken every day to make sure that the radiation is leaving your body. Drinking plenty of fluids will help this process because most of the activity is flushed out in your urine and sweat. You should also take regular showers and wash yourself, as this also helps remove the sweat and associated radioactivity. We will advise you to flush the toilet twice so that any radioactivity is safely flushed away. You will now spend between 2 and 5 days in this room until your radiation levels have reduced.
You're doing fine.
You will be allowed visitors, but they must talk to you through the glass window for their own safety. You must not leave the room until you are told that it's safe to do so. If the fire alarm sounds, the nurse looking after you will instruct you what to do. Following the radioiodine treatment, you will have a scan using a gamma camera to see where the radioiodine has gone in your body. You'll be asked to take a shower and put on clean clothes beforehand. You will then be taken from the cubicle to the nuclear medicine department, where you'll have a full body scan. A strap will be put on top of you to secure your arms, and a blanket will be laid for your comfort. During the whole body scan, the cameras will be quite close to your body for a short time. A CT scan may also be performed, as will a special type of scan called a SPECT, where the cameras rotate around your body. If you have the CT scan, the bed will move in and out of the scanner as the images are taken. Once all the scans have been performed, the physicist will take another measurement of the radiation in your body and will talk through the written restrictions with you for your return home. You will receive a card to take home, and a letter will be sent to your GP. If you receive thyroid injections prior to your treatment, then a blood sample will also be taken. You may be asked to return to the nuclear medicine department after several days to check the levels of radiation left in your body. If the activity is low enough, the restrictions will be lifted and you will be able to carry on as normal.
Can I welcome everybody to this, the 99th meeting of the Thyroid Cancer Support Group for Wales. I think that's phenomenal, especially when you think that our secretary has been at almost every one of those. So I think you deserve a round of applause.
My name is Cy Davis, and I'm the secretary and one of the founder members of the Thyroid Cancer Support Group Wales. We started in 2004 because a lot of patients realised there was no support for people with thyroid cancer because it's such a rare cancer. So we formed a self-help group, and it's grown from strength to strength. We meet about every 6 weeks here in Velindre Cancer Centre, and we decide what we can do to raise funds, to support research. We also have telephone support for new patients and their families, and we do our best to support patients with thyroid cancer. And so this is one of the group meetings here tonight, and we'll talk and discuss what we're going to do over the next few weeks, and probably for projects into next year.
You've got someone in the hospital doing blood tests and monitoring you, and then someone else,
Yeah, one of the members here tonight is Richard Egan, who is a consultant endocrine surgeon in Modeston, Swansea, and he's kindly offered to run the London Marathon for us this year, and he's raised over £4,000–5,000 for the group. So we're very grateful to what Richard has done.